All right. I'm so excited to be here with you, Amy. So thank you for being here.
Happy to
Um,
be here.
so I'm here with Dr. Amy Perlman, who will be teaching a class on pills that power pleasure, what every sexual medicine provider should know. Um, that sounds incredible. Tell me a little bit about the course.
So here's the thing. When I think about the conversations we have with patients when it comes to medications, we don't do a great job at having informed consent about how to actually take the medications. It is so common that I see patients in my clinic who have failed Viagra, who have failed Cialis, who have failed penile injection therapy. When in reality, when you actually sit down and you talk with that person, I've realized we as healthcare providers have failed to educate our patients on how to actually optimize those therapies. And the reality is, and what I've learned over the years, is when we actually sit down with someone and we tell them, do you take it with or without food? What are the cost considerations? Are you averse to needles? How do you do technique to minimize any discomfort? Then patients remarkably tolerate these medications and actually do quite well with them. So I think it's very important for sexual medicine providers, especially those that are in the therapy space, to know this information because you all have the most touch points with these patients where you're talking to them. So, what a gift it is if you can help us as urologists and we can have this shared conversation so that the patients are getting the information they need to know. So, I'm
Absolutely.
gonna I'm gonna give you a master class in what you got to tell the patients.
I love that because, so many people are frustrated and think that they're just going to take a pill and swing and, all this is going to happen because they haven't been educated around it. And sometimes mental health professionals also don't ask the right questions to know if that's the case.
Exactly. So we're going to tackle medications that are FDA approved. We're also going to tackle some of the medications that are now available through compounding pharmacies. And a lot of my patients are coming in and they're coming in and getting medications from Blue Chew and Rouget and these other companies. And so I'm also going to take a deep dive into what these medications actually are. It's not enough for us to tell our patients, oh, no, don't take that. It's not FDA approved. No, patients are taking these medications. A lot of them are working for patients, and we need to be able to discuss them in a way that's evidence based when there is evidence, but also just educating patients on side effect profiles. So, we are going to take a deep dive into everything our patients want to know about pharmacologic therapy. How does that sound, Rachel?
It sounds amazing. Can you give us one like takeaway, like maybe one medication that's compounded that people might not know about or something that they can take away and hold on to?
Yeah, absolutely. So there's one medication that is a compounded formulation where they're actually combining four therapies: Viagra, Cialis, apomorphine, and oxytocin. What I think is interesting about some of these novel therapeutics is they're working on the penis and they're working on the brain, right? And I think that's what your providers and me, it's like that's the holy grail is how do we work on the entire body? And if we can do this with one medication or a combination of therapies, I mean, that might be the magic ticket. I don't know, but we'll have to see. You'll have to stay tuned.
Oh, I can't wait. Thank you so much. And I'm looking forward to the course.
Awesome. Me too.